Hi, everyone, and welcome back to the Divergent Vibes podcast. I'm Hannah, and I'm joined by the lovely Alison today. So, welcome. And do you want to introduce yourself in any way?
Firstly, Hannah, thanks very much for the invitation
Good.
to join you today. My name's Alison Bale. I'm a mindfulness teacher and I do body work. I've worked a lot with people living with chronic pain and long-term ill health. And I guess both professionally, but also through my personal experience of working in the corporate world and working for myself, I'm very interested in the relationship that we have with ourselves, how that affects how our mind behaves, how we handle stress, what we feel physically. Very interested in the neuroscience of it all and how there are times when we absolutely think we're going mad and no, we're not. We are entirely human.
Great. I'm very excited to dive into all of that kind of stuff and geek out about neuroscience a bit, maybe. Just to acknowledge it is very warm today. So we've got two fans going. So if you pick up some noise in the background, that's that. And hopefully it's not too distracting. But I think it's already quite difficult to think. And if we didn't have them, I would just be a puddle on the floor.
We would. I would certainly be a puddle on the floor, yeah.
Yeah. So yeah, really great for you to be here. And yeah, lots of great stuff that you do. But I wonder today, what do you want to talk about?
I think that there's a few things. When we met in Cheltenham, a number of things that you said about neurodiversity and being on the spectrum resonated with me. I don't have a diagnosis, but it resonated with times in my life in terms of how I've seen myself, how I've related to the work environment, how I've handled myself under pressure. And it really got me thinking about a lot of my work is about trying to help people understand how the brain actually works and how the nervous system works versus how we actually think it works. But how does it work? And what does this mean for our physical health, our mental health? So I'd like to dive into whatever elements of that you think would be of most use or of most interest to your audience.
Yeah, I don't know where to start. I could tell you where my mind went to.
Go on.
Talking went to. So I've started doing some work around pain. And this week actually we were talking about the biology of pain and the nervous system and that kind of protective role it has. And they told this interesting story of someone who was 29 on a work site and they stepped on a nail. I don't know if you know the
I
nail.
know I have the story of two nails actually
Two nails.
that I use when I teach people. Okay. Little bit of background on me. I'm a retired chiropractor. I spent 20 years working as a chiropractor in the UK and in India. And so a lot of my professional background has been working with people who are living with long-term pain. And long-term pain is complicated. We've known for a very long time that for a large number of people, you cannot comfortably categorize them into an MRI says this, therefore the person's experience of pain will be this. Particularly with back and neck pain. We've known it's not that straightforward. We haven't entirely known why. So let's start with two guys on work sites. Don't go anywhere near building sites, anybody, okay? But two guys on work sites involving nails. And our guy number one, if it's the same story that you were told, gets off a piece of scaffolding and basically stands on a piece of wood that has a nail in it, and the nail comes up through his boot. Is this the one you're expecting? So. Okay. And he's in agony and he's screaming his head off, and all his colleagues are very concerned, and an ambulance is called, and off to hospital we go. And when they get him to hospital and they've given him painkillers, he's still in a lot of pain. They x-ray the boots so that they can see what's happening before they take it off. And when they x-ray him, what they find is this. The nail has actually gone between his toes. It hasn't punctured the foot. All right. So there isn't actually an injury. And yet this guy is in a lot of pain. Is he imagining it? No. He's in a lot of pain. And that's a very important point, is that whatever we discern as the cause, pain is always real. Okay. It's just that the brain and indeed your spinal cord play quite a big part in essentially in what the brain thinks is going on, because you've mentioned it already beautifully, this idea the brain's job is to protect. All right. But the brain exists effectively in a black box. It's inside your skull. It has little or no, it has a tiny bit, but very little direct contact with the outside world, or indeed with your internal world. So everything that the brain receives, it receives in some form of electrical and also chemical communication that's coming from various receptors that are in touch with the outside and the inside world. So what the brain has to do is take a whole plethora of electrical signals and say, what does this actually mean? And I rather liken it to, information arrives at the brain that says, nail, foot, sticking up through. And it's a bit like this information arrives with a big committee meeting and they all have a discussion about, have we seen this before? What do we know about nails in feet? Is this a problem? Do we need to do anything? Are we at risk? And a conclusion is then drawn. And that conclusion is this is extremely dangerous. It's very painful. And pain is the resultant body signal. And pain is one of the most powerful protective signals that we have. It's powerful because it's very hard to ignore. All right, you tend not to ignore it. Its point is to alert you to danger, to tell you to stop doing things. If you've turned your ankle, stop standing on it, rest it. So it's designed to protect you, but it's actually a system that can go wrong because not only does the brain perceive things that are happening in the moment, but over time, and this is what happens with chronic pain, over time, the brain and the spinal cord become more and more sensitized to, it could be to thoughts, to feelings, to situations, to people, to activities. And the brain in particular builds up a picture that says X is dangerous. So if you've had a problem with your back and you've been told with the best of intentions that running is bad for you, okay, but running's something you really like to do, but you've been told it's bad for you. And in fairness, you've had experiences of running and your back hurts more. Anything that involves you moving fast becomes a danger signal, but it also becomes a frustration if running happens to be something you like. And those two things together act a bit like a volume knob, all right? You can turn the sensitivity on the system up. And if you do, normal activity and normal movement starts to become more and more painful. Something I noticed a lot when I was seeing patients in chiropractic was the number of people for whom it was the everyday that was causing problems. It's the people who came into my clinic room and they didn't want to sit down. Okay, because moving from standing to sitting and sitting to standing again was really, really uncomfortable. And I'd often say to them, look, to take the history, would you rather lie down? And so I'd get them to lie down to take the history. And I'd try to arrange my examinations so that they didn't have to move very much because it was everyday movement. It was the turning over in bed, and it wasn't so much the volume of pain, it was I can't kick a football around with my son or daughter in the evening. I'm not only in pain, but I haven't got any energy. I remember somebody very clearly saying to me once, I've stopped going on picnics because I'm really worried that if I have to walk on uneven ground, it's going to be a problem. And all these things collect together to form this, if you like, this danger in me network. And the louder that danger in me network gets, A, the more pain you get, and B, the more restrictive it all gets. Okay, the pain starts to run your life. And a lot of the work that I do today is to help people, A, tune into their body a bit better. If anything, we try to get a little closer to the signaling, all right, to make it not quite so scary, but also to learn how to work with the body and mind so that we can start to turn that volume knob back down. Because the great thing about the nervous system, and particularly the brain, is that throughout our lives it's neuroplastic. That means it changes, but just as a muscle builds if you work it, circuitry in the brain builds according to how you use it. So if you start to purposefully direct it down the line of safety rather than danger, it doesn't mean you put yourself at unnecessary risk. That's the opposite of what we want to do. But you can start to teach it safety. And when you start to do that, the symptoms begin to decrease. But I've realised I was going to talk about two nails, because there's a sequel, there's another nail story.
There's another nail, yeah.
And this, again, it's a construction site, and it's a guy using a nail gun that backfired on him. And he felt something hit his face, but it was a bit bruised, but it didn't feel too bad. He didn't think there was too much of a problem. There wasn't much evidence. And he thought, okay, I'm all right. Next few days, he's getting a lot of pain in his mouth and his side of his head, and he thought it was a dental problem. So he went to his dentist, who took an X-ray, and one of the nails had gone backwards into the head, near the eye, and was very close to puncturing the tissues that surround the brain. Now, that would have been very dangerous, but this guy was not actually particularly concerned until he saw the X-ray. All right. Because from his brain's point of view, he couldn't see anything particularly wrong. So he wasn't getting any visual stimulus to confirm this is a problem. In fact, he wasn't really getting any stimulus to say, you need to be worried about this. You need to be concerned about this.
And the pain, he didn't think, oh yeah, I got hit.
Yeah, he just thought, yeah, well, I've just got a bit of bruising. Maybe it's a tooth problem. It's not a big deal. It's nothing to worry about.
Yeah.
So it's very malleable. I have a friend who works in this area, and she's both a researcher, a therapist, and she lives with chronic pain. And she uses this lovely word. She says it's slippery. And I like that. It's slippery. Yeah. And it's not going to be the same for any two people, because we all arrive in circumstances in our life with our own set of beliefs and our own set of values. And those precondition us to have our brains and our minds and our bodies reacting in certain ways.
Something I noticed for myself is I had a different thought in my head. This one I'm going to go with Steph, what you just said, that slipperiness. I grew up by the sea, and there was this concrete thing that went out into the water. So when the tide was in, you could jump off, and it was great fun. That's actually a sewage outlet. I found out as an adult. So I've grown up swimming in sewage. But I've always had like a pretty good immune system. I very rarely get ill. And it's something I'm like, yeah, I'm pretty, like, what, that's been my sense of myself, like quite a robust, probably because I swam in sewage a lot. So it's become kind of a story. But then I had a big bereavement a couple of years ago. And I've had some real health anxiety since. And I think that kind of someone dying very young, it kind of changes. You're like, oh, wait, am I okay? What's going on? What's this feeling? What's this? And you can see like how slippery it is, that story I had about myself, or that sense of how worried I am about different feelings in my body just kind of wasn't there before. And then it's something that then, now I'm sort of trying to go back to like, no, wait, remember that, remember what we had before. But that, slippery is a good word for
that. This whole issue of what seems dangerous to me and what promotes safety. In two different people, the very same thing can provoke wildly different responses. Let's take the issue of, you're told you need to go for an MRI. Now, if you've somebody who's perhaps seen quite a lot of doctors and felt a little bit that you're not being taken seriously, when somebody says, we're going to send you for a scan, you might actually feel a bit relieved. Bit of a sense of safety. I'm being taken seriously. I'm being listened to. This is great. I'm going to get some answers. All right. Okay. That's scenario one. For that person, go and have a scan is safety. All right. It's reassuring. But imagine you're somebody in a very similar situation, similar set of circumstances, and this applied to somebody I worked with not long ago. She'd had a relatively recent incident of feeling absolutely fine, being sent from a routine scan and finding that she'd got cancer.
Mm.
And she'd successfully been treated and she felt really well. But for her, a suggestion that you go and have a scan is going to provoke a very different internal response. And it's not about either person being right or wrong. It's about different experiences, different conditioning, different belief systems, and being in a different place in their life.
I was thinking when you were saying about the boardroom example, and I loved that example, and I was thinking about the work I do with people psychologically. I was thinking about psychological pain and how we experience that, but I was thinking about at that table in the boardroom, I imagine we have our like 5-year-old self or whatever who has all of those experiences we've had and our history, and is also there being like, but what about this? And what about these things? And so much of our experience is probably shaping those decisions.
And everything that you've ever been told about how you're supposed to be in certain situations. If you've been brought up being told you have to be tough, if you've been brought up being told you have to be busy, if you've been brought up being told that it's good to push on through and it's good to be resilient and you mustn't let things beat you. These all combine into how do we respond when we're confronted with challenges? How good are we at recognizing what we need? Because that can often be a big challenge. But just a little thought on the neurogeeking and this whole business of today they call it neuroplastic pain, which I think is a bit more accurate. That means pain that's being driven by sensitivity in the nervous system. But in past, it might have been called psychosomatic, which for the record, it's used pejoratively, but it shouldn't be because it just means the psycho talks to the soma and the soma talks back. Yeah. And they do constantly, and they're in constant communication and constant misunderstanding as well. But what I was going to say is one of the things that we now know is that if you are subject to chronic stress, that starts to activate exactly the same pathways in the nervous system as if you had a tissue injury. And your brain cannot tell the difference. In either circumstance, it's getting to a point where it's starting to say, this is not sustainable. We need to be careful. This is something we need to be worried about. I'm going to find a way to tell you. And the problem is the mechanism that it uses, pain, is actually, it's a wonderful loud hailer. It shouts, but it doesn't shout very coherently. Because one of the things that characterizes chronic pain versus the acute pain, with acute pain, we usually know what we've done. All right, we've just tripped over, we've just stubbed our foot. We know what we've done. The pain stays very localized, and it's generally very bad to start with, and it gets easier as it heals. Chronic pain can come from nowhere, or it can come from having done something that's really innocuous. The number of people who've said to me, well, I was just reaching into my handbag to do, or I just got out of bed the wrong way. Something innocuous. Where was I going with this? But it spreads. It can move around the body. It can go from one shoulder to the next and then across the two. It can go from one hip to the other side. It really can move around. And sometimes where we feel the worst pain is not actually where the origin of the problem is, which can also make treatment very frustrating and difficult for everybody.
I was just imagining like a little person with like an alarm who's like the nervous system activated. It's like, oh, it's over here. And it's just like running around going like, there's a problem, but just moving around. And it's like, where is the problem?
And if you're dealing with sensitivity in the nervous system, it gets harder and harder for the brain to be able to go, right. Because the brain does actually have a bit up here whose job it is to go, it's the right big toe. But the more it's being bombarded with information, the less good the system is at actually being able to localize and say to you, right, you need to do this.
Yeah. I think when you said about the psycho and soma, I find it really interesting that the body and mind connection has been so neglected in a lot of like in talking therapies. And even right at the start of, with Freud, he was like, the ego is a bodily ego. So he was like the body, the mind, and then it's just not been talked about. And now we're starting to be much more, oh wait, there is this connection and this interaction, which are just a random aside that I find very interesting that we're starting to kind of recognize it.
Yeah, I mean, I think we've finally reached the point where we've realized that for so many people, this is the situation. Therefore, we have to get better at managing it. I think what is complicated, and it's certainly complicated if you're on the receiving end of it, is that we still essentially have a healthcare structure, not just in this country, but around the world, that puts everything in silos.
Mm.
If it's your kidneys, it's a renal specialist problem. If it's your bones and joints, it's an orthopedic. If it's an inflammatory arthritis, it's a rheumatology, and puts things in silos.
Mm.
But it's also complex because the truth of the matter is, firstly, yeah, you do actually need to rule out the physical injury. In fact, I was reading something this morning about the percentage of people diagnosed with effectively psychosomatic disorders who, as we improve testing, as we improve imaging quality, it suddenly transpires there was a physical issue. We just couldn't see it before. So you've always got to have that at mind. Is there something here that we're not able to image, or can we not see it or test for it clearly enough? Because we're limited by the tools. But the fact is, if you really want to engage with the body and mind as a whole picture, it's messy, right? It's individual.
Mm.
A lot of the solutions are actually not necessarily high tech, not necessarily very expensive to implement, deceptively simple sometimes. That doesn't make them easy. But a lot of things that help do not cost an arm and a leg. And so therefore you can't make a lot of money out of them.
Okay.
Not wishing to tread onto too many difficult, but you know what I mean. There is a bit of a driver here sometimes that we get sucked into the idea that something's shiny and it's new and it's expensive, so it must be good. And I was actually reading a post from somebody the other day who's a nutritionist she does very high end, very bespoke, very science-based testing, but she's just stopped doing one because she was doing it with a lab that was taking, although it was a very high-end test, very specific, the lab was inconsistent about getting results back to her. It was taking a long time. That was frustrating her. It was frustrating the patients. And she kind of went, okay, I know this is shiny and new, but I'm going to stop doing this because it's not helping the overall picture of how I support people who come to me.
Yeah.
And I think sometimes, it's okay to go with the simple stuff.
Yeah. I wonder if you've been living with something for a while and it can feel like I've tried everything, so it has to be this big solution, and we often don't go to the simple.
Yeah.
You were saying about that kind of moving towards safety, and we've been kind of talking about the nervous system, and bearing in mind that it's very individual, as you've said, but are there any kind of general things that could be a starting point for someone to think about if they're wanting to make that move towards safety or feel more regulated?
One of the strongest things you can do is be prepared to name what you're experiencing. And name it in the context of it's here now. And that might be as simple, if we're dealing with pain, somebody being able to say something to the effect of, pain is here. Better still, I notice that pain is here, or I notice that anxiety is here. The power of saying, I notice that, is we immediately create a little bit of a space between the bodily experience the mental interpretation of it and who we are.
Mm.
And that space in itself creates a little bit of safety.
Mm.
But also, when we mentally acknowledge that what is happening is happening, it sounds counterintuitive, but that automatically takes some of the fear away.
Mm.
Because you're kind of saying to yourself, all right, I'm going to acknowledge that X is here. I'm not going to ignore it. I'm not going to try to pretend it isn't. I think that's really important.
Mm.
And that's very central to mindfulness, that we learn how to turn towards things, but that we learn to turn towards our experience with a degree, and this is always as much as you can muster,
Mm.
of kindness and consideration for yourself.
Mm.
And I think sometimes people find that very hard to muster. I certainly did. It was one of the big learnings for me as I got older, that I needed to listen to how I was feeling.
Mm.
Because I very much grew up with I can push through anything,
Mhm.
nothing is too much. But that also resulted in whatever I've done or whatever I've achieved or however much work I've put in a given day, it's not enough.
Mhm.
Until actually somebody said to me when I was teaching mindfulness, she was a mental health nurse, and she said, okay, Alison, so what would be enough? And I kind of, it was like, oh, one of those rock you back on your heels
Mhm.
moments, because it was like, well, nothing.
Mm.
And then it was like, well, Alison, how can you ever rest if you never think? And it
Yeah.
that reframed my whole way of listening to my body and thinking about myself and being prepared to go, okay, one of the ways you can orient towards safety is by saying to yourself, what do I need now?
Mm.
All right, what do I need now? And you know what, usually, and this is based on my personal experience, but this is often what I need, is to do one or two things. One is slow down.
Mm.
And I literally mean slow down, move more slowly, walk more slowly, slow my speech down, slow my movements down.
Mm.
Because when we kind of start to rush and get faster because we're anxious or we're worried or whatever, the brain actually gets more agitated because it very often can't quite cope.
Mm.
All right. Something I should have said earlier, this business of naming what you're experiencing, it shifts the focus of the brain circuitry into this front part here.
Mm.
And this is where you can start to think, do I need to just sit down for a few minutes? Do I need to step away from my screen? Do I need to go for a walk? Do I need just to look up? Moving your eyes is often a very powerful thing you can do to just shift state. Do I need to just look up?
Mm.
Do I need to just do some, I can't remember the word they use for this, but you slow your rate of breathing to 5 or 6 breaths a minute. And how I do it is I just breathe in for a count of 5 and I breathe out for a count of 5.
Mm.
And that gives me, it means that I'm doing a full breath every 10 seconds. That's 6 breaths a minute. And sometimes just doing that will be enough to break the habitual cycle.
Mm.
And the other thing I've really found that I've had to learn to do, and I'll often say to other people, if somebody asks you something and you get that sense of any moment now, I'm going to say yes, but I might really want to say no. And you
Mm.
get that internal that goes with that. I've learned to say, I need to think about it. And this is, for me, this is another version of slowing down. I
Mm.
need to buy myself time. But you know what? Funnily, it's actually the wrong wording, because actually what I don't need is more time to think. Because another mistake I think we make with the brain is we're very much taught that thinking and, the brain logic operational, that's the solution to your problems. And therefore, if you've got a problem, more thinking
Mm.
is going to solve it. And very often, that's actually not the case. And my husband has this wonderful habit of he'll ask me what I want to do about an arrangement or a situation, just as I'm about to go into a meeting or I'm about to go out the door to do something else. And I remember very clearly he asked me something once and I immediately had a bit of a panic because honestly, I didn't really know what I wanted to do. And I managed to say, I need to think about it. I'll get back to you. And actually, what I was just about to go out the door to do was go to the gym.
Mm.
So I went and I lifted weights
Mhm.
and actually didn't think about it. But by the time I got back from the gym, I knew exactly what I wanted to say and exactly how I wanted to handle it because I'd actually just effectively taken my brain offline, gone and done something with my body. And while I was doing that, my brain went, yeah, okay, we know what we need here.
Yeah.
And the longer I've practiced mindfulness, the longer I've practiced meditations, the longer I've practiced just noticing when I'm heading off on one, the quicker I get at being able to say, actually, I do know.
Mm.
I do know what I want. I do know what I need. But sometimes we have to buy ourselves time.
Yeah.
We have to allow ourselves not to know for however long we need not to know
Mm.
before the answers become
Yeah.
emergent, they become apparent.
But I find exactly like you say, I can get caught up in the thinking, but actually my most creative ideas or solutions come I've had a shower, I'm in the car often, or I'm not thinking about it. And then it's like it just appears. It's just like, oh, here is an answer, or here's an idea, or here's, that kind of thing. And I wonder as well, some of it where, particularly when it's someone's asked us to do something, we notice that no, how much actually it isn't about us thinking about it. It's I need to figure out how I can say no and this relationship will be okay. It's a lot about our relational communication.
Especially if we've grown up in a household as I did, where saying no wasn't an option. You had to say yes. And then you emerge into adulthood with, firstly, I had to learn that no was a thing,
Mm.
all right, that I could actually say it. And it was actually okay to say it.
Yeah.
And it was okay to say it, even if I wasn't quite sure why I was saying no.
Mm.
And I couldn't give you a clear justification. But picking up on something you just said, there's a practice that we use in mindfulness. You might have heard of it. It's called a stop practice.
Mm.
Very useful, very quick exercise where you just say to yourself when you need to, stop. And the stands for stop. So just stop. T is take a breath. O is, as best you can, try and observe what's happening. If you've got any commentary running in your head, and it's something we've touched on before, sometimes the commentary is auditory, you can hear it, but some people find they can see it like a cine screen.
Mm.
Some people don't have anything, but if there's a commentary running of any description, an inner monologue, what's it saying?
Mm.
If you're noticing body reactions, tightness, hardness, often it'll be here, it'll be upper chest, it'll be solar plexus. It's usually somewhere in the torso is most obvious, but not always. But usually torso is most obvious. Or you perhaps notice that you're actually not really breathing, or you're just taking quite short, shallow breaths. And any emotions that you notice coming up. Or you notice that you've got a sense that there is an emotion, but perhaps you can't label it, you can't name it.
Mm.
So that's the S, the T, and the O. The P is then supposed to be about proceed, because what you've done with the S, the T, and the O is you've created a bit of a space for yourself, a space between wherever the stimulus was and however you're going to respond. You've created a break. That's good. But very often what I find, and I say this to everyone, you get to the P and you don't know what to do. And that's all right. It's all right that you've created the break. And the P, for me, sometimes emerges several days later.
Yeah.
And that's all right too. And I think sometimes we just have to get comfortable with going, I don't know. I don't know what I want to do. I'll tell you when I do. framed in a way that's comfortable for you. But if we don't know, we don't always know.
Yeah.
It can be very hard to learn to tune into your body and know what you're feeling.
Especially if we've not grown up, as you said, in a household where that's modelled.
Where that's model, it's not modelled, it's
placed.
not expressed, it's not safe. Something that interested me that I came across recently, though, very much is what we tend to do in this country, and not just in this country, is we tend to intellectualize feelings. And what I mean by that is that we want to be able to say, I'm anxious, I'm scared, I'm depressed, I'm whatever. But in some indigenous cultures, if you ask people, what's the body sensation? They will stick very much to a sensation and they'll say, I'm hot, I'm cold, I'm tense here, I'm tight here, I'm relaxed. They won't try to go, and therefore it means. They'll just go with the sensation. And I think sometimes that's it. For a long time, I found I couldn't really tune into my body. And it's actually, I mean, I've been meditating for 30 plus years, but it's only very recently that I was working with a teacher who actually was able to say, generally the easiest places to start to pick up body sensation are in the torso. It's either abdomen, solar plexus, front of the rib cage. So just concentrate on that. And if you don't notice very much, or you find that your mind's tending to always go, what does that mean? I want to know what that means. I want to understand it. There's an art to just being able to go, all right, I just noticed that this is reacting a bit, and I don't quite know what it's reacting to or how, but I'm just going to observe that I'm getting a reaction here. Again, coming back to what you said about safety. Just putting your hands there sometimes could be what you need, all right? Or just putting them here. There's some practices that, you want to just give yourself a bit of a gentle stroke. And again, the pacing is really important. Okay? If you're noticing you're rushing it, thinking, oh, I'm going to do this, that's an opportunity to go, no, I'm going to slow it down. I'm going to be more deliberate.
Yeah. So interesting. I find mind, body, everything. I'm really curious how you got into mindfulness, and you said about having been a chiropractor and then making this switch. And, was there anything that sort of led to that change?
There's a whole bunch of things. I mean, for first things first, I was a meditator long before I was a chiropractor. I've always quite enjoyed sport. I was a swimmer and a horse rider as a child. I'm not any good at sport, but I got into running and really enjoyed it. And I think, but I did tend to be quite an uptight person, quite stressy, difficult relaxing, difficult letting things go. And I just, part of me began to think, Alison, you do all this work to look after your body. You really should be doing something to look after your mind as well. And so that's what actually led me to start meditating. And I just started with CDs, with books, reading around the topic, working out my own practice. I got no training. I was working in the corporate world and I got moved, a job I was doing got moved to London, and I went from a 30-minute commute each way to a 2-hour one, and I hated it. And there were a lot of internal problems in the team. And I just reached one of those times in my life where you think, I'm either going to stop moaning and get my head down and make this work for me, or I need to get out and do something else. And I started thinking like that. And at the time, I had a sharing horse, and saw an article in a horse magazine about McTominay chiropractic for horses. And it was like a light bulb went on. It said, here's a job with horses that might pay decent money. And just out of interest, I sent off for a prospectus at the college, and virtually everything I'd done in my life felt like it was about being on the road to being there. I had science A levels. I'd done history and philosophy of science in my first degree. Um, I was the right sort of age. I was early 30s at this stage, and McTimoney did a modular training, so you could fit it around work. It was weekends and study weeks, and so it all fitted. And you had to do the human course before you could do the animal course. I said, right, I'm doing it. And as bizarrely as it turned out, I did both. I qualified for both, but I loved the human work. Absolutely felt like this was my tribe, this was my home. I never wanted to be anywhere else. Didn't enjoy the animal work as much. In fact, never really practiced. But only a couple of years after I qualified, we moved to India. And I guess what happened then, as I went along, the more I worked with people living with all sorts of aches and pains, the more I began to realize that for every one person where it was actually fairly straightforwardly mechanical, and they tended to get better quite quickly, and they tended to stay better with not much in a way of just a bit of occasional maintenance, they'd stay better. But there were people who didn't respond that way, or where there were all sorts of anomalies around what they were experiencing versus how old they were or what else was going on. And I gradually began to think there is more to this pain expression business. There's more to this healing business than we can see in a set of blood tests or on an MRI. And there was more and more research saying that when people are living with chronic pain, or indeed when they're living with conditions sometimes that are not going to get better, some people come to me knowing that we're not actually going to solve the pain. What was needed were things that people could start to apply to support themselves. It wasn't that they didn't need someone like me, but they also needed some empowerment, some agency, some reassurance. They needed some way to put those safety cues in themselves so that they could bring the pain symptoms down with some confidence that they could manage it to some extent themselves, and that would then enable them to start getting back to more of their life. And this all really started to coincide with me getting a bit older. I had every perimenopause symptom under the sun and a few extras that aren't normally in the textbooks. And I had a lot of joint pain in my hands and my wrists. And I began to think, it's not, I want to keep working. I love what I do, but it's not sustainable for me to keep doing 4 to 5 days a week, 8 hours a day, bending over a bench. It's just not going to happen. One of my hobbies is needlepoint, and I kept thinking, Alison, you carry on like this. I developed a trapped nerve in this hand, and I began to think, Alison, you carry on like this, you're not going to be able to do your needlepoint. You start to lose the capacity to do things that are meaningful for you. And what advice would you give other people? And so I decided to train in the mindfulness, because mindfulness really does put the skills, the options, the choices. You know, people talk about meditation, but the whole mindfulness, which is much more than meditation, is about helping people see that they have choices, they have options, and there are ways for them to craft solutions for themselves. And so I was really keen on starting to move towards doing something that meant people were not dependent on me. It was giving them some options for themselves. So, and my original plan was I was going to train in the mindfulness, and I was gradually going to shift my workload. I started cutting back days in my clinic for chiropractic, and I started teaching mindfulness. And I thought I'd get lots of people through with chronic pain because that's what everybody knew me for. But actually, what came to my door was quite a lot of midlife women having problems with overwhelm, with sudden anxiety when they'd never been anxious before, difficulty managing relationships that were important to them, finding that they were less and less tolerant, And things that they put up with before, they suddenly weren't putting up with, and they were not feeling like themselves. And that was actually a lot of what I was seeing. It feels like a long story short. I got to a point where I decided I was going to take some time out. We'd been in India 15 years. We never intended to stay that long. So we were looking at coming back to Europe, but we didn't know if we wanted to come back to the UK. So we thought we'll come back for 6 months. We'll spend 6 months in the UK. I was going to do some teacher training so that I could train people in to teach mindfulness. And yeah, we were just going to take stock. And then we were going to reshape our clinic in India because I was working with a clinic room at home and that was getting a bit overwhelming. Anyway, all of this was 2020. You know, well, that year went. So that got written off. Tried coming back to the UK, but there were all sorts of problems with visas for India. The UK locked down again. Travel was really difficult because this was before vaccination. So I thought, well, we'll go back to India for the winter and we'll try again in 21. And then India went on the UK's red list, and we didn't really want to spend the money and stay in a hotel for 10 days. And so everything got back a few years, it got put back a couple of years, and I just went, you know what? I don't want to run a full-blown chiropractic practice. But I think it's been a theme a bit in my life. And I think it's sometimes something that we sometimes find hard to accept, that sometimes it's the right time to stop doing something. However much you've loved it, however much you've been successful. I think we arrive at points in our life where we go, this isn't right for me anymore. This doesn't fit me.
Yeah.
It's rather like, you know, as you start to change shape a bit as you go through menopause, and suddenly some of your clothes, which you loved, not only do they not quite fit right anymore, but somehow they don't quite belong in your wardrobe anymore. And that's okay. It is a time of rewiring and growth, and it's right that we change. And I think it's right that we get better at saying, so what are my priorities now? What does this new version of me look like?
I think it's yeah, as you were talking, I was lots of thoughts, and thank you for sharing some of your experience. And I think that there's a real courage, isn't there, in kind of going, this isn't working for me. It's not right for me anymore. I tried this thing, and it could be that we try something and we fail, and it's like, actually, that didn't work, or we were successful and actually, no, it's time for something else. And being able to go, actually, there is, yeah, real courage in being able to tune into yourself and go, this isn't right, and I'm going to make a change. Um, and I think also that there's something about our sense of ourselves generally, isn't there? There's our story and kind of who we've been, and then that present kind of who we are. And yeah, I always think in like relationships, sometimes you can get tension when we naturally change and you're trying not to, the other person has to stay the same and you don't want them to change. But I think we possibly also with ourselves are a bit like, no, this is who I am. And actually being able to go, well, actually I am changing. And what is that new me? And what still feels right for me? And that might be different to 6 weeks ago, 6 years ago, but I can still be like, who am I?
Yeah, and I think it can be really uncomfortable if the changes that are being presented to you do not fit the version of you that got you to your successful wherever you were before. I mean, when you say about people changing in relationships, it's quite a running joke. Certainly where I trained in chiropractic, that there would always be in any given year group, there'd be a few relationship breakdowns, because as you learn about yourself through the training, you change. I mean, when I look back to me starting the change, I started training me for starters. I don't really know where I found the courage, because it wasn't exactly my brightest move. I got a really good job in the City of London. I went freelance, and with the man who is now my husband and has been my husband for 25 years, but we weren't married at the time. He worked for himself. So there was only one salary coming into the house, and that was mine. And I was going, no, I'm going freelance to be a chiropractor. Yay. And we were actually about to get married. We were getting married the following year.
Mm.
But something about the path felt right. And I can only say that it felt aligned. People use that word, and I don't think you always know what it means, but internally, I think you know when something is correctly aligned. And one of the one of the things that we'll teach in mindfulness, we teach a set of attitudes that you bring to yourself. And I ultimately think it's the attitudes that bring people the biggest benefits. And one of those attitudes is trust. And one of the things that trust means is learning to trust you. Trust your instincts about what to do when and how to manage a situation for you. Throughout an 8-week course, I'll teach all manner of meditations, but I'm always saying to people, for each of the given weeks, I want you to work with the ones that we're working on, the new ones I've introduced. But understand this. Some of them you're going to find you're really going to resonate with. Others you are not. In fact, I was just teaching this week, and I was teaching one in particular, which can be difficult for people with pain in particular. And so, again, coming back to this notion of safety and danger, I'm sure you'll be familiar with the window of tolerance, that we have we have windows, as it were. Okay, we have this window within which we can cope. There might be stresses coming up, coming down, but we're within a gap that we can cope. But you don't actually want to be pushing yourself outside of that. But there's great value in knowing how and when to push yourself out your comfort zone. That's not just what I'm talking about. Sometimes being outside your comfort zone is where you need to be. And certainly if you're going to navigate what you were just talking about how when we change as people and we change in our relationship to ourselves, and we change in what we want from our lives and what we want from our relationships, we have to be comfortable with discomfort, because it's not comfortable to start, especially if you start challenging things that you've always grown up with and always taken for granted. It's not comfortable, and that's all right. But it's knowing also where your window is and when to push and when not. That's actually at the heart of recovering from pain as well. Knowing when to push and how much, and when to go, no, that's actually too much. And it's an art.
Yeah, it really is. So I think that so much of what we've talked about with pain, I think, is so applicable for, I guess, emotional pain, psychological pain.
Yeah.
And it speaks to that connection, doesn't it? The mind, the body, it's all part of that whole us and our experience. And it's something I've been thinking about. I've been updating my website a little bit and thinking about, well, what do I actually do, or how do I actually work? What do I actually believe? And it's so much about that whole experience and that connection, and who am I and what feels right for me, and figuring that out and being able to tune into ourselves. And that can be really difficult to do, to actually sit and think, who am I?
I've reworked mine several times, and I'm not there yet, because there's layers and layers and layers and layers to this experience of who we are.
Yeah.
And our perception of that changes, and how we want to express that changes. Coming back to the question you asked me earlier about why move out of chiropractic and onto mindfulness. And I think for me, there's a fundamental that I wish to leave the world a better place than I found it. How I express that could take any number of different forms. It isn't actually about what title I have. In fact, to some extent, and this has been this for me is a whole new area of complexity to navigate, is I prefer not to be labeled anymore. I prefer to be a human being who supports other human beings in finding the answer for them.
It's difficult, isn't it? Because we like to, who are you? What do you do? There's something in us that, and so if you just had a website, I'm a human being that supports me.
God, it makes your 60 seconds in networking a lively. It really does,
Just a person.
Yeah.
Standing in front of another person. Like.
Yeah.
So I'm conscious of the time. We've like breezed through. So I wonder if you've got any final thoughts of things that you you know, for topics we've talked about, or anything else that you kind of had in mind that, like,
I think coming back, we've just talked a little bit about trust. Um, but some of the things that I found the most helpful to learn in my own life, and I hope they're helpful for other people as well, is I endeavor to be more accepting of what's under my control, which is not actually as much as I think generally. It's what's going on here is under my control, and how I interpret what I feel and how I'm going to respond, but very little else is under my control.
Mm.
Um, I endeavor to be less judgmental
Mm.
of myself. I'd been working in a situation, supporting a friend through her startup, and honestly, there've been so many times when I've thought I should probably walk away. But there's part of me that can't bring myself to do that until I know I've exhausted every opportunity to make it work. If I know I've done absolutely everything I can,
Mm.
and we fail, as we may,
Mm.
to be accepting of that and to be not judgmental of that, especially as my husband reminded me the other day, Alison, when you took on this role, you were going to do it for 3 months. It's been 2 years. I think you've done enough. But so it's that whole judgment.
Mm.
Um, and to let go of the things that I cannot change. If there's
Mm.
things that happened in the past that I wish had gone differently, I can't go back and deal with them now.
Mm.
And I do try to plan a bit less and to hold myself to a slightly more flexible. If things don't go exactly the way I thought they should go, that's probably okay. There may be a reason for that. So let's
Mm.
just and I've tried to get out of my own way in the sense that I used to really have a tendency to try and overplan, overthink, overmanage. Trying.
Mm.
And actually that's taken a lot of stress off myself.
Yeah.
And I like that.
Yeah.
And I like that a lot.
Yeah.
And be appreciative. I feel very privileged and very grateful to be where I am and to have what I have and to do what I do. And I'll just keep clinging on to that, because I think that's important.
Yeah. See. Yeah. I mean, so many thoughts going through my head, but I'm conscious of the time, and then we can just dive back into stuff. But thank you so much, Alison, for joining us.
My pleasure.
Yeah,
Absolutely
that
my
you've
pleasure.
shared. And thank you everyone for watching along or listening along. And yeah, that's it. That's it. Thank you.
Brilliant.
Yeah.